Needs of pregnant and breastfeeding women. A comprehensive guide. Pregnancy and breastfeeding are two of the most critical periods in a woman's life, during which her body undergoes significant changes to support the growth and development of her child. A well-balanced diet rich in essential nutrients is crucial to ensure the health and well-being of both mother and baby. Among the vital nutrients, folate and iron play a pivotal role in supporting fetal development and maternal health. In this article, we will explore the importance of these nutrients, discuss other essential nutrients, and provide guidance on how to meet these nutritional needs. The importance of folate. Folate, a B vitamin, is essential for fetal development, particularly during the first trimester of pregnancy. It helps prevent birth defects of the brain and spine, such as neural tube defects, NTDs. Folate also supports the production of red blood cells and helps prevent anemia in both mother and baby. The recommended daily intake of folate for pregnant women is 600 to 800 micrograms, mcg, per day, which is higher than the recommended daily intake for non-pregnant women, 400 mcg. Food sources of folate. To meet the increased demand for folate, pregnant women can consume foods rich in this nutrient, including 1. Leafy greens. Spinach, kale, and collard greens are excellent sources of folate. 2. Legumes. Beans, lentils, and peas are rich in folate and other essential nutrients. 3. Citrus fruits. Oranges, grapefruits, and strawberries are good sources of folate. 4. Whole grains. Fortified cereals, bread, and pasta are good sources of folate. The importance of iron. Iron is another essential nutrient for pregnant women, as it supports the production of red blood cells and helps prevent anemia. During pregnancy, the body's demand for iron increases to support the growth of the fetus and placenta. The recommended daily intake of iron for pregnant women is 27 mg, mg, per day, which is higher than the recommended daily intake for non-pregnant women, 18 mg. Food sources of iron. To meet the increased demand for iron, pregnant women can consume foods rich in this nutrient, including 1. Red meat. Beef, lamb, and pork are excellent sources of iron. 2. Poultry. Chicken and turkey are good sources of iron. 3. Fish. Shellfish, sardines, and anchovies are rich in iron. 4. Legumes. Beans, lentils, and peas are good sources of iron. 5. Fortified cereals. Many breakfast cereals are fortified with iron. Other essential nutrients. In addition to folate and iron, pregnant and breastfeeding women require other essential nutrients, including 1. Calcium. Crucial for fetal bone development and maternal bone health. 2. Vitamin D. Essential for calcium absorption and bone health. 3. Protein. Supports fetal growth and development. 4. Omega-3 fatty acids. Important for fetal brain development and maternal heart health. 5. Vitamin B12*. Essential for the production of red blood cells and nerve function. Meeting nutritional needs. To ensure they meet their nutritional needs, pregnant and breastfeeding women can take the following steps. 1. Eat a balanced diet. Focus on whole, unprocessed foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats. 2. Take a prenatal supplement. A prenatal supplement can help fill any nutritional gaps in the diet. 3. Stay hydrated. Drink plenty of water throughout the day. 4. Avoid excessive caffeine and alcohol. Limit or avoid caffeine and alcohol, which can harm fetal development. Breastfeeding and nutrition. Breastfeeding women also require a balanced diet to support milk production and maternal health. The nutritional needs of breastfeeding women are similar to those of pregnant women, with a few exceptions. Breastfeeding women require 1. Increased calories. An additional 500 calories per day to support milk production. 2. Increased protein. An additional 25 grams of protein per day to support milk production. 3. Continued folate and iron intake. Breastfeeding women should continue to consume adequate folate and iron to support maternal health. Conclusion. Pregnancy and breastfeeding are critical periods in a woman's life, during which her body requires additional nutrients to support fetal development and maternal health. Folate and iron are two essential nutrients that play a pivotal role in supporting fetal development and preventing birth defects. A well-balanced diet rich in whole foods, along with a prenatal supplement, can help meet these nutritional needs. By understanding the importance of these nutrients and taking steps to meet their nutritional needs, pregnant and breastfeeding women can ensure the best possible outcomes for themselves and their babies.